Hi guys, my name is Kevin Shaw and I'll be doing Obamacare. So Obamacare, as you may know, is the Affordable Care Act of 2010. It was implemented by President Barack Obama. Barack Obama was the former president of the United States. He enacted this policy in order to mitigate the high cost of healthcare. He wanted to make sure that everybody had healthcare. In order to do this, he decreased the cost of healthcare and made it necessary for you to have healthcare. Otherwise, you would be facing a tax penalty. And Obamacare was a term that wasn't really there before, but it was coined by critics. But after a while, the name ultimately stuck. So that's what it is. So I'm going to be talking about accessibility. Accessibility means who can get it, who can't get it, this and that. So before, patients weren't able to get the services they need because insurance companies did not want to insure these high-risk patients, kidney disease, cancer, whatever it may be. They just didn't want to insure them because they cost a lot of money, and the insurance companies, they just don't want to spend that type of money. So they couldn't get what they needed. Once Obamacare was enacted, people with pre-existing conditions could go to the doctor and could. Before, they would have to wait and then go to the emergency room and then end up having bills which they weren't able to pay. But with Obamacare, they were able to get care beforehand in order to stop the problem from getting bigger than it needed to be. So this is what the ACA does. When it increases healthcare costs for everybody else, it actually makes it easier for poorer people to pay for it. So it basically pays for more people to have it. And an important fact is, Medicaid was extended to those who pay up to 138% of the federal poverty level. So I'm going to be talking about the 8 Obamacare pros and cons. So essentially it slows the rise of healthcare costs because people don't have to worry about paying so much for healthcare. Another thing is pre-existing conditions. So people with pre-existing conditions were able to get healthcare now. The next thing is cover 10 essential health benefits. So there are all these health benefits. And then children, so small children, they were able to stay on their parents' healthcare plan. So the cons were, so the income tax rate had to increase. And it had to increase because in order to increase the coverage of healthcare, they needed money. And the only way they can increase money is by increasing taxes. So that was a problem. And then it taxed those who didn't purchase insurance. So while it made it easier for some people to get insurance, other people just couldn't afford that insurance because it was just too expensive. So people just didn't buy insurance and then they got taxed. So people would rather pay the tax because the tax would usually be cheaper than the coverage that you wanted to pay for insurance. And then there was this donut hole gap, so pharmaceutical companies had to fund this gap. So I'm going to be talking to you about the tax penalty. So the tax penalty, it was a penalty that, if I mentioned before, was in order to make sure that everybody had health insurance. Obama had a good idea because he wanted everybody to have health insurance and he wanted a global healthcare system which worked. But this system had its flaws because you had to pay health insurance for 9 out of 12 months and face a tax penalty. And the problem is, people can afford it sometimes, but sometimes people can't afford it. People could barely afford the plans they were paying in the first place, but now with this tax penalty, they were forced to pay. And because of that, sometimes they just didn't have the money, and when they didn't have the money, they had to pay a tax penalty. And this tax penalty, it adds up, and it's just not good because why should you have to pay all these extra taxes? You could be doing other things with your money. Instead you had to pay a tax penalty. So the rule was, if you made more than $200,000 a year, or if you were a couple who made $250,000 combined income every year, you had to pay additional taxes. Your taxes were mostly the ones that helped fund this plan in the first plan. And it's $250,000 for married couples and health-related businesses, and then For if you're a business owner, you had to have 95% of people have health insurance, otherwise you were taxed. The problem with that is sometimes people just cannot afford the thing, and most companies would probably have to pay a tax penalty because 95% is a lot of people. It's like 47 people, and having 47 people to get your insurance, they can barely pay their bills as it is. They live paycheck to paycheck. So how would they be able to fund an insurance? How would they be able to fund money for insurance? So right now, what is going on? So the ACA wants to mitigate healthcare costs. So they want to have preventable care instead of emergency care, because sometimes it may be too late, and these emergency visits can last a really long time. If you do preventative care, you save costs and you can treat the problem quicker. You don't want to let the problem get too big. So it's a good thing that they did it because they want to prevent it before it happens. Why have to worry about curing it when it happens when you can prevent it before it even happens? I think that's a really smart idea. But I think with Obamacare, it's just not good because it's a good plan, but maybe the execution could be better because people just can't afford it. And I know what he's trying to do by trying to fund everybody's healthcare and trying to create a healthcare system, but it just doesn't work because people just cannot afford the healthcare costs, and more people are going to be paying a tax penalty. Why should all these people be having to pay a tax penalty? Everybody should have insurance, but I'm sure there's another way. But I just think that this plan was just not good enough. But pre-existing conditions should be there because people with cancer and stuff, they should be able to get care because cancer can be a constant thing. Kidney disease can be a constant thing, and they need to be able to treat it every day. Otherwise, it could turn into something bigger that they may not be able to help in the future or help long term. So Congress, they try to make changes to Obamacare, and because Trump is president now, he's in the Republican Party, he tried to make changes to Obamacare. He liked some of the things, but he didn't really like Obamacare. He wanted to just repeal the system. But the problem is, it's the House and the Senate. So the House is the Democratic Party. He's a Republican, and the Senate's a Republican. In order to get it accepted, he has to pass the House and the Senate. So the Senate would be okay, but he wouldn't be able to get it past the House because it's Democratic, and these Democrats like the Obamacare, so they're not going to change it. So he won't be able to implement a new plan. So this is why this plan is in place. I like Obamacare, but I think that it could be better, and I think that the new plan should be appealed.